You may notice that I am not Bailey Shamazardi, who gave our introduction video, but big thank you to her for helping to support us and to describe the session today. We're really looking forward to spending time with you all. All right. And Nathan, can you give me a thumbs up if you see a table of contents slide now?
Yep, I see it.
Awesome. Great. Awesome. So we're going to go ahead and get started with our welcome and introductions from your speakers today. I'll be sharing about ACEs and PCEs promotion and some strategies that may be useful and helpful in that work. And then Nathan is going to take us through a kids data dashboard overview. And then we'll have time for questions. And so if there's things that we can be helpful with, just let us know. So our goals today is to describe some of the efforts that are taking place through the California Department of Public Health Childhood Adversity Prevention efforts. And this is going to specifically touch on the Essentials for Childhood initiative, the All Children Thrive California initiative, and some pieces that have to do with child fatality. And then our hope is that we can support you to confidently navigate kids data dashboards, particularly on things that can help you find data, to customize your searches, to use data on specific topics, geographic regions, and/or demographic groups of interest, and interpret and understand what data shows about the well-being of children and families in California. And we also are interested in helping you to explore related resources, research, and program and policy options. So today, your presenters are myself, Elena Costa. I'm the Chief of the Violence Prevention Program Section in the Injury and Violence Prevention Branch at the California Department of Public Health. And also my colleague Nathan Porter from the Population Reference Bureau Kids Data Program is here as well. And so Nathan is a senior research associate in the and his focus is providing non-technical data users with rigorous, intuitive information and web-based tools for informed decision-making, specifically around issues that impact child and family well-being in local communities. So first, we could start with just an overview of what ACEs are. And so just to help us get rooted and grounded, and I think most folks here are pretty familiar with this topic, but it always helps me to just have touch points when I'm going into webinar. So ACEs are traumatic events that occur before the age of 18. Often we think of ACEs typically as the 10 that you see in this graphic to the left. And they include things like abuse, neglect, household challenges, and other forms of adversity across the socio-ecological model. And those are the forms of ACEs that you see on the right-hand side. And so folks often agree that witnessing violence, experiencing discrimination and systemic racism, feeling unsafe outside the home, being bullied, experiences living in poverty, or experiences or contact with the child welfare system can be ACEs as well. Some folks also highlight natural disasters and war as another form of adversity that should be mentioned as well. So we know that ACEs disrupt healthy brain development and alter immune and endocrine systems and change how the body responds to stress. ACEs can negatively impact education, employment, earnings, and health over a person's lifetime and can extend to future generations. We also know that as the number of ACEs increase, so does the risk for those outcomes. But the presence of ACEs does not promise that a child will experience poor health and life outcomes. And there is evidence that protective factors mitigate the impact of ACEs. And those things we often think of as the antithesis of ACEs, which is positive childhood experiences, or PCEs. So PCEs are experiences that engage a child, a caregiver, and the child-caregiver relationship. In these experiences, we know that they're critical for fostering resilience and that they can have a mitigating effect on the impact of ACEs. Research shows and has examined the prevalence of ACEs and their association with adult mental health outcomes. And PCEs were there was a review undertaken through a study that evaluated adults on the following questions. And so it is how often or how much as a child they felt able to talk to a family about their feelings, felt their family stood by them during difficult times, enjoyed participating in community traditions, felt a sense of belonging in high school, felt supported by friends, had at least 2 non-parent adults who took genuine interest in them, or who felt safe and protected by an adult in the home. So some work that we really admire here at CDPH really centers around PCEs and the healthy outcomes from positive experiences, or the HOPE framework. And this framework can help us refer back to how we describe PCEs and how we can elevate those positive experiences through policy systems and environmental change strategies. You know, one of the most noteworthy things for me is that PCEs can be done by any individual, or, you know, we can support young people through undertaking and fostering PCEs as individuals, or we can do those things through policy change. And so the HOPE framework categorizes the PCEs into 4 types, which are relationships, environments, engagement, and emotional growth. And this framework is also helping to provide organizations, communities, and individuals with an accessible and actionable framework for undertaking PCE change efforts. And so this website that captures the 4 building blocks of HOPE has a variety of resources for those who are serving in child serving systems, or are undertaking various types of policy strategy change, or just looking to, as individuals, to impact and make a difference in a child's life. So let's talk a little bit about some strategies. This is what we're really excited and passionate about here at Public Health. We're very invested and interested in looking as upstream as possible to find ways to reduce and prevent ACEs and also other forms of violence. And so because we know that ACEs and PCEs shape emotional regulation, brain development, and health outcomes, and that experiencing 4 or more ACEs increases those risks, it's really important to think about prevention strategies that can keep ACE scores low. We know that there are better health outcomes when a person has a lower ACE scores, and that an ACE score of 3 or less are combined with higher PCE scores. And this includes behavioral health outcomes too. So some strategies that we recognize through a piece that we put out in partnership with the Department of Social Services, Office of Child Abuse Prevention, and the All Children Thrive California initiative, which I'll describe more about shortly. We highlight and note that implementing existing state laws that prevent and reduce firearm violence, such as gun violence restraining orders, can be helpful. We note that supporting the implementation of existing state laws that support or enforce the safe storage of firearms and medication could be of use. Expanding access to school-based behavioral health professionals, culturally responsive care systems, services, and mobile crisis teams can help to ensure reliable connections for youth to trusted adults and behavioral health services. And that implementation of state laws that strengthen economic supports for children and families, like ensuring folks have access to VITA sites for tax filing, that individuals and families are claiming CalITC and YCTC and CTC paid family leave, can all be of support. We note that strategies that specifically can promote positive childhood experiences, and that when we're alongside ACE prevention strategies, can help us to create policy systems and environmental change to foster resilience and better health outcomes across the life course. And these can be things like establishing youth coalitions and creating youth leadership opportunities, ensuring that young people are exposed to and are social emotional learning and school improvement programs, that when collaboration is strengthened between schools, families, and community-based organizations, we can have better opportunities for youth engagement, youth mentorship, and linkage to trusted adults to foster a sense of connection, belonging, and support across settings. And that community investment in safe and inclusive spaces such as youth centers, parks, libraries, and after-school programs that encourage exploration, connection, and consistent adult support are also very valuable to strengthening California's communities. So with that, I'm going to transition now to describing a little bit about how the California Department of Public Health Violence Prevention Program Section programs that are focusing on childhood adversity prevention are organized and some of the work that they're doing. So we have three main efforts that we utilize within the Violence Prevention Program Section to prevent childhood adversity. And these are the All Children Thrive California Project, the California Child Fatality Surveillance System, or CCFSS, and the Essentials for Childhood Initiative. So first I'll talk about the local approaches that are being undertaken through All Children Thrive California. This is an initiative that's statewide. In the map on the right-hand side, you can see everywhere where there is a funded project. This work is really engaging community members to participate in community coalitions to identify the problem and solutions to childhood adversity. And the goal is to transform policies and systems that will improve child well-being. And so in these coalitions, there are residents, there are young people, there are youth leaders, there are staff, there are community leaders or gatekeepers that are, living in these communities who know best what those problems are. And they are a part of naming the problem and then participating in designing solutions to create change. And so right now, there's been multiple iterations of All Children Thrive, but at various points, there's been about 30 coalitions across the state that are undertaking the work. All right. So our other strategy is something that is known as the California Child Fatality Surveillance System. And so CCFS tracks data on child fatalities that occur in California. And the Department of Public Health Injury and Violence Prevention Branch is offering limited reimbursement to counties who voluntarily submit their child fatality case data into the system. And so the data that is collected through the system could or does have the ability, if we were to have enough counties participating, that we could guide and inform prevention strategies to reduce and prevent child fatality in California. So some of the data that's collected includes the information about the child, information about the parent or the primary caregiver, information about the official manner or primary causes of death, details about case investigation and findings, and then services that were provided to the family and the community. So right now we're limited to funding $150 per child fatality case, but those dollars don't have restrictions on them, and so they can be used by the county to look at strategies for prevention. All right. So then and our final way that we're going to describe today about that the department is working to prevent adversity focuses on the statewide approach. And this is known as the California Essentials for Childhood Initiative. And this is a partnership project that's led between the Department of Public Health Injury and Violence Prevention Branch and the California Department of Social Services Office of Child Abuse Prevention, and a body that is known as the Essentials for Childhood Initiative Steering Committee. And so the steering committee is made up of PACEs, or positive and adverse childhood experiences, subject matter experts, people who work on behalf of priority populations or those with lived experience, and they are tasked with guiding the initiative to address ACEs as a public health issue, raise awareness and commitment to providing safe, stable, nurturing relationships and environments, and positive childhood experiences, and that they inform the implementation of primary prevention strategies to promote social norms that protect against violence and adversity. And they are also supporting us to build and strengthen data infrastructure that can create PCEs change across, PSE change across California. And so Essentials for Childhood recognizes that ACEs are a significant public health problem, and the real and focus is to promote safe and stable nurturing relationships and environments, and improve the conditions that help to foster positive childhood experiences. And so we are pretty committed to upstream primary prevention strategies that shift social norms and reduce adversity before it occurs. And so another major part of the work, as I mentioned, is that last bullet in the list that's focused on strengthening California's data infrastructure. And one way that we're doing this is by making ACEs and PCEs data widely available and accessible, and thinking about health equity. And these data are available in a variety of ways. We're creating dashboards and reports and briefs and web-based tools to support communities and partners. And a critical factor and partner in this work has been Kids Data, who for, oh my goodness, more than a decade has been our partner in developing dashboards that share about childhood diversity and well-being and other risk and protective factors, as well as social determinants of health data that helps inform prevention strategies and identify inequities. And so I'm going to turn it over next to Nathan, who's going to share more about the work that Kids Data does. And hopefully, Nathan, you can take it over. Sure.
Sure. Elena, I don't recall whether we had Kids Data slides in this deck. If not, that's totally fine. We can just, oh, here we go. All right. And maybe we can go to the next slide. There is one. All right. Well, I'll just, thanks, Elena, and I'll just introduce myself very briefly. My name's Nathan Porter, and I'm with the PRB, or Population Reference Bureau, and I work on the Kids Data program there, among some other projects. And so I think the plan, or my plan for the next 15 minutes or so, is to give you all the crash course on using our website, Kids Data, to kind of get the data that we hope can inform your prevention efforts, and also maybe help you identify families and communities where you might focus those efforts. So what is Kids Data? Maybe we can go to the next slide. Thank you. So Kids Data is a program of PRB. PRB works in California, in the US, really throughout the world, on projects to improve health through evidence-based decision-making. And we provide support primarily as a research partner and a data provider. Kids Data is PRB's program specifically about the health and well-being of kids in California. So we can go to the next slide. Thanks, Elena. So Kids Data provides data on around 60 topics related to kids' health. We have more than 1,000 indicators or individual data sets on the site, and those data sets have current and historical data, usually down to the city or the school district level, and we have breakdowns for subpopulations where those are available. So I guess we can move on to the next slide. And now we're going to do a live demonstration. So again, it's kidsdata.org if you want to follow along, or you can just follow my lead. But I will take over, share my screen, and we will go to the Kids Data homepage. All right. Can folks see that, Elena? Okay, excellent. All right. So I'm just going to move one. Okay. All right. So here we are at the Kids Data homepage, and you can see here just below the Kids Data header, there are these tabs. And these tabs represent, these first three tabs at least, represent the three ways that data are organized on the site. We have data by topic, data by region, and data by demographic. I think today we'll focus on data by topic. This is kind of the most basic way that data are organized on the site. But we'll come back. I think we'll have time. We'll come back to data by region because I imagine that some of you probably have specific counties or geographic areas of interest. So what I'm going to do first is I'm going to click on data by topic. And this page shows basically the basic organization of the data on our site. So first we have our kind of first organizing layer is these broad data categories, and you can expand those data categories, for instance, family economics, into what we call data topics. And then within data topics, you can expand a topic to show the different data sets or individual indicators that we have in a specific topic. And one thing I'll point out is that you'll notice here that, for instance, in this topic and kind of throughout the site, we have data that are broken down in different ways. So here in this block, we have data on child poverty rates according to the California Poverty Measure, for instance, but we also have these same data broken down in a number of different ways. So that's, again, the kind of the basic organization. We have these layout for every topic on the site. Every topic on the site has a summary page, which you can get to by clicking on this summary link. And so I will just click there. And then this will take us to a summary page, or what we call a summary page. On the left-hand side, you'll see the different indicators that are available in this topic, the same list that we saw previously on the data by topic page. There's a spotlight of a select number of data visualizations based on indicators in this topic that we think are particularly insightful or interesting. You can click through those using this slider here. We also have a link to a PDF, two-page kind of high-level overview that highlights key data and provides some background on the issues. And then below this spotlight here, we have some additional resources that you can get to either by scrolling down or by following these jump links near the top of the screen. So we'll just go through these really briefly. The first one, so all of these topics kind of provide supporting context for the data that we show on the site. And the first one here really describes the importance of the data to issues in child and family well-being. And this why this topic is important section, this is meant to reflect kind of the current research landscape. So these are researched. We provide links to original source material and things like that. So that's why this topic is important. The next section describes kind of what the latest data are telling us about how kids are faring on the measures that we present. The section below that, policy implications, again describes what are some kind of program or policy changes that that could maybe help kids and families do better. Again, research-based narratives here. And then finally, we have links to other organizations working in the field other research and reports, and things like that. So that's kind of the basic layout. And we have this set of contextual sections or narrative sections for each of the around 60 topics on the site. So these here are specific to food security because we're in the food security. So that's kind of the topic at the summary level. Let's jump into an indicator. So I'm going to scroll up to the very top. All right, and so to select an indicator or to get into a data set so that we can actually customize the data and find exactly the data we want, you can choose within the topic. If it's an indicator within the topic that you're currently in, you can select that here. You can also select from that previous page where we were, the data by topic page. Sometimes the fastest way, though, is just to use this search bar, which is available from every page on the site. And what you can do is you can just enter a topic or an indicator that you're interested in. So I will enter Medi-Cal enrollment, and the site will start to produce some matches. The other thing you can do is you can enter an indicator and a location that you're interested in. So maybe we're interested in Medi-Cal enrollment in Yolo County. You press enter, and then the site should generate a series of hits or best data matches. And then what you can do is here we see on this first link, we have Medi-Cal average monthly enrollment for Yolo County, and we can click on that. And then this will take us directly to the indicator page. And here we'll see data for just the location that we selected, YOLO, and then typically we'll also have the parent geography for comparison. So that's how the search works. So now we're in an indicator page. We're in another topic. We're in healthcare, but we'll just go through the process of customizing data in this indicator. So I guess the first thing we can do is let's look at all of the counties. So here in the left-hand rail, we have all of the regions for which data are available. We can click select all counties, and then there we have the full data set at the county level. So before we jump into customizing the data, there are a couple of things I want to show. The first is that below every table on the site, we have a set of definitions, data sources, and footnotes. And these can be really useful when first looking at a table, particularly if it's not clear exactly what the table is measuring. So these can be really useful, and it's often the first place we recommend folks go when they come to an indicator on our site. I'll mention too that again, we have another set of those narrative sections that we showed earlier, this time though about healthcare rather than food security because we are in the healthcare topic. So let's scroll back up and we will customize some data. All right. Well, so often, when folks come to kids data, come to an indicator, they have a specific question in mind. So just for the sake of illustration, suppose we want to know how many young people in Alameda and Contra Costa County were enrolled in Medi-Cal on average each month in 2021, say the first year of the COVID-19, the first full year of the COVID-19 pandemic, and how those numbers compare to what we see today. So to customize data, the first thing we can do is if we want to change the data type, the year, other kind of basic data characteristics, breakdowns if those are available, is that we can click anywhere in this gray bar here. There are these edit links, but we can click in this gray bar and it shows the options for which we can customize the data. So we were interested in 2024, so we'll leave that, but we're also interested in 2021. And say we want to look at number data instead of percentage data, we can select that here. We press submit. And now we're seeing 2021 and 2024 data for all counties. We are only interested in 2 specific counties. So the easiest way to do that would be in the left-hand menu here. We can just clear all of the counties, essentially start over, and then we will select Alameda and Contra Costa County. And so here, if you came to kids data with that specific question, you've now found your answer, hopefully. And so these are the numbers that you were interested in. They're in a tabular format. The other way we can customize data that I want to or one other way that we can customize data that I want to show really quickly is that we can change the way in which the data are visualized. So we're looking at a table now. We could also visualize these data as a bar. Bars can be really useful for being able to visualize differences quickly at a glance. One thing we're showing here is we're showing data across 2 time periods. If we want to look at data over a longer time series, we can click the trend tab here, and then this will generate a trend graph, again showing data typically over the entire time series for which we have data. So for this particular measure, we have data going back to 2012, and we can see the trends in the number of young people enrolled in Medi-Cal in these 2 counties over that time period. We can add locations. Again, suppose we come down and we want to add Yolo County, the original county we searched for. We can click Yolo here. We see that YOLO is quite a bit lower than the other ones. Again, probably because we're looking at numbers, right, and not percentages. So Yolo County has a smaller population. So if we wanted to do this type of comparison, again, it probably makes more sense to look at percentages rather than numbers. And so we can, again, edit the data, click on percentage, and now we see trends that are relatively similar across the locations. We can add more locations. Here's Tulare. The numbers have changed, but here we see, for instance, that in Tulare County, substantially higher percentage of kids or young people. This is 0 to 20, I think, are enrolled in Medi-Cal on average each month. So that's one way to do a comparison. In this case, we're looking at a comparison across counties. Another way to do that kind of within a single year is that we can visualize these data on a map. So I'll click the map. And then what we're looking at here is we're looking at percentages for 2024. And this is really a county level heat map that shows the percentage of kids 0 to 20 enrolled in Medi-Cal each month on average. And darker areas represent higher percentages of kids enrolled. And so what we can do here, for instance, is if we're interested in a specific county, suppose we're interested in Sacramento County, we can click that here, and then we can zoom in and it shows us where our county is in case we don't know, and the percentage. And then these maps are basically built on Google Maps, and so they retain a lot of that functionality. We can zoom in, we can recenter, we can do those types of things. And then the other thing we can do is we can hover over and we can see, for instance, how rates in Sacramento County compare with its neighbors. So that's kind of the basics of customizing, visualizing data. So maybe here, we can look at a map like this and kind of get some sense kind of geographically for where there might be kinds of concentrations of families who could benefit from prevention supports. But one thing we can do on kids data where we have additional breakdowns is that we can dig a bit deeper and we can look at different ways in which data are broken down. And so what I will do now is I will scroll back up and we can click on this change indicator button beneath the indicator name. And when indicators are broken down in different ways, the different ways in which they're broken down are available from this list, and you can choose those, or you can choose a different indicator entirely. So thinking about this measure, for instance, maybe we could look at an age breakdown, which gives some sense for maybe the types of services that might be appropriate for a community. Language might give us clues as to how it would be best to reach families. And then race ethnicity, for instance, could point to disproportionality across populations. So we'll select race ethnicity, and then we'll press submit. And then we'll go to a page where we're looking at the same data, statewide data, but broken down by the race ethnicity groups that are available in the data source. We're always limited by what's available from the source, but we present what we can. So here we see, for each of the groups presented, the share of young people in that group enrolled in Medi-Cal each month on average. This is the case where you might look at this table and you might think, oh, well, what the table is showing is that among kids enrolled in Medi-Cal, say 64.4% are African American or Black. And that's actually not what the table shows. And so what it's showing is that among African American or Black young people in California, 64.4% are enrolled in Medi-Cal. And so this is a case where it's useful to look again at the definition and the footnotes to make sure that we're interpreting the data as they're being shown. So that's that. Let's compare a couple of groups here. And again, we'll click up here into this bar. We'll stick with 2024 data, look at percentages, and suppose we want to compare white and Hispanic Latino young people. So again, I've selected just the groups. I've deselected the groups that I'm not interested in for the sake of this example. And then we'll press submit. And then again, we can visualize these as a bar to kind of take in the differences at a glance. And then here we can see, again, 2024 percentages of young people enrolled in Medi-Cal. And we see, for instance, among Hispanic Latino young people, the share is almost 3 times what it is for white young people. So again, just a way to kind of customize data, get them to show exactly what you want. Suppose this is exactly what you want to see. So these are the data that you want. These are the data that you're looking for. You'll want to do something with these data now. So I'm going to show you a few things that you can do from the website with these data that you've customized. You can click download and other tools here, and this gives you a few options. So if you're working on a report or a presentation or a grant proposal, you can copy the customized image into Word or into PowerPoint. You can download the data that you're looking at as a formatted Excel file or an unformatted CSV file. You can get that 2-page overview that I pointed out earlier on the topic summary page, and you can also include your customized graphic at the end of that PDF. And then you can also take this table and embed it on your website or blog or whatever other web page you manage. These embeds basically have all of the customization potential that the originals do. And then when we update the data on our site, they will automatically update on your site as well. So, and then of course you can always share these on social media, email them to a colleague. You just grab this URL. This URL will retain all of the customizations for your data. And then the other thing you can do is you can sign up here. You enter your email address and you will be automatically notified every time we update new data in this topic. So if you're interested in healthcare and you want to know whenever Kids Data updates new data on that topic, you can enter on healthcare. You can enter that here and you'll receive what we call an e-alert every time we update new data. So that's the basics of customizing data on kids data. So maybe, I think we do have a little bit of time. We'll talk really briefly about data by region. So far we've come to kids data with a question, and we've gone through the process of answering that question using information from specific indicators. But you may work a different way. You may approach your work starting from a place or a population instead. And so that's where data by demographic and data by region give you the option to look at all of the data that we have for your area or population of interest. So I'm going to click on data by region. And here we have a list of all of the regions or geographies for which we have data on kids data. I'll scroll down and let's select San Diego County. So we expand San Diego County, we can get county level data for San Diego County, but also for sub-county regions. So we have data on, say, school districts in San Diego County, cities in San Diego County. So you can explore there. I think for our purposes today, I'll just click on the county level data. And then this will take us to a page, another kind of summary style page with data specifically about San Diego County. So what we have here again on the right is we have a summary or a few data highlights that are specific to a particular data category. So in this case, we're looking at data visualizations using indicators from our demographics topic. We can change this. So we can change from demographics to education and childcare. We have a different set of options here now. These are interactive like the other visualizations that we saw on summary pages. So we can compare the availability of childcare in San Diego against California generally. We can customize the charts, do all of those usual things. The other thing we can do is, I mentioned that this was just kind of a summary of data that we have on education and childcare. You can click here on See All, and this will take you to a page where we show all of the information that we have on education and childcare. So if you're interested in seeing data specifically for a county, you can do that here. You can explore. The other one neat thing that you can do on data by region is that you can create a custom profile for the region that you're interested in. So, and this will produce a report that shows just the measures that you want. So what I'm going to do is let's create a custom profile for San Diego. I click on create a custom profile, and here we're seeing again the same list or the same tree that we saw on the data by topic section of the site. So let's look at annual cost of childcare, availability of childcare for families. I'll scroll down and we can look in the family economics category, look in family income and poverty. We can choose children in poverty according to the California poverty measure. And then maybe we want to look at the percentage of children living in food insecure households. So we have selected a handful of indicators here. This is a custom profile for San Diego. And so what I'll do is I will click submit. And then we've generated a report for San Diego County showing just the indicators that we selected, or just the indicators that we were interested in. So what we can do then is from this page, we can print this report. And then for each of the individual tables here, we can download or copy like we did before. We can click the customize table link, and that will take us to the specific indicator page where we can customize the data further. And I'll just click that. So we'll go into food security. So again, now we're back in the food security topic, and we're showing the data from the custom profile, and then we can customize these however we want. So that's another way to kind of access data through the site, as opposed to thinking topically. You may think about your work regionally or focused on specific demographic groups, and you can do that through the data by region page. I'll mention data by demographic. Data by demographic works similarly. Data by demographic does not have the option for creating custom profiles, but if you are focused on a specific population, you can get data specific to a group of selected populations on the data by demographic page, as opposed to looking at data by region. So that's kind of the high level overview of kids data. The one thing I will mention is that if you want to keep up to date with us, we have an email subscriptions link here. It's kidsdata.org/emails. I'll put it in the chat. But from here, you can sign up to receive Kids Data News, which is the newsletter that we send usually every month, and that highlights new data or new or noteworthy data that have recently been published on the site. And from here, you can also select and manage those data alerts that you can sign up for from individual indicator pages. So I guess one thing I would encourage you to do is to all sign up right now to receive data alerts on our childhood and adversity topic because we are working with Essentials to produce some new data on ACEs and PCEs. So we're hoping those will be out. We feel like we're close. We're hoping those will be out very soon. And when those are live, so if you sign up, uh, you'll get an email and you can follow the links in that email, and then you will be taken to the indicator pages that look and work exactly like the pages that we just saw today. So you'll be able to hit the ground running, customize the data that you need, um, and and use new, fresh data that we'll have on PACEs in California. So that's it. That's what I have. I'll stop sharing my screen. I'll put the link to our email subscriptions page in the chat. And then I guess, Elena, we have some time for questions.
We sure do. So folks, if you have questions for Nathan or myself, feel free to add them to chat. Meanwhile, we're going to just run through a couple things. Highly recommend that, as Nathan shared, that you sign up for email updates from Kids Data. There's terrific newsletters that come out regularly and alerts about data that we find really tremendously helpful in our work, and it's just a great resource. But we'll also just quickly share a couple more PACE resources that may be of interest to you. So a little bit ago, we shared some strategies on how to consider improving child well-being to address ACEs or PCEs. And so that came from a piece called Reimagining Child Well-Being, Local Policy Strategies to Prevent and Reduce ACEs in California's Communities. And this includes a menu of 44 strategies that could be of interest to you all. And there is an update that's being undertaken currently to re-examine the strategies and look for ways that we can update the information and make it fresh and more useful, and potentially address violence more broadly as well. And so there's a QR code here, and I can't see the chat, but I think there's a link going in soon. We also have a resource called The Impact of Positive Childhood Experiences on Behavioral Health. And so this piece shares some information about adoption and implementation strategies that are rooted in promoting PCEs and how conditions can be created to improve youth behavioral health and long-term health through a variety of approaches and practices. And it's a resource that can support folks who are looking to adopt and implement evidence-based strategies to prevent ACEs and promote PCEs in California's children. We have a couple reference pieces, but want to pause here for a moment before I switch to our last slide and see if there's any questions yet. No pressure either, just. Okay, all right, so hearing none.
There's a question in chat, sorry.
Oh,
there's a question in chat
Bailey.
From Daniel for Nathan. Daniel asks, can you remind me where the data comes from on kidsdata.org? Sorry, Elena, I didn't mean to cut you off.
No, that's great. Thanks, Bailey.
No problem. Well, data on kids data come mostly from publicly available sources. So we get a lot of data from state level sources, also some national sources. We get survey data, we get administrative data from state agencies. I did drop a link to a list of some of the major sources that we use on the site. But again, beneath each one of those tables or visualizations on the site, there will be, in addition to the definition and any interpretive notes, there will be the data source. So you can always find the data source there. Where the data are publicly available, we'll include a link so that you can go to that source and look at the data yourself if interested.
Thanks, Nathan. All right. So just a sincere thank you all for joining us today. our facilitators want to encourage and remind you to consider registering for the next webinar in the series, and that will be held on April 8th. And it's called If Help Had Come First, Lived Experience on Community Pathways. And there's a QR code to scan if you are interested in registering now. Also, there will be an evaluation link that comes to you all to consider completing, just so we can take efforts to improve and ensure that the webinars and ensure that content and information is useful to you. So with that, that's the end of our time today. And we're